everyone, it's Taylor again. I have Karen back as my patient. Karen's 54. To save purposes for the time of this video, because I only do have 10 minutes, we went ahead prior and did the Snellen eye chart, and at 20 feet away, Karen was able to cover both eyes and read the 20/20. So she is 20/20 in both eyes. She has no issues with distant vision. I do have a book for Karen. Just going to open to a page. Has very small fine print reading. Are you able to read any of this? That would be a no. So I'm going to get her readers. Karen has issues with reading close up. She does have non-prescriptive readers.
We dressed up in the dark flight suits with full armor, and both Ned and I had MP5s. You could never predict too much about a night assault.
There we go. So we know that she has an issue with near vision. I'm going to ask you to remove your glasses. I'm going to take a look at Karen's eyes. They're both symmetrical to the face. Both of her eyebrows are brown, full, and intact. No open areas. She still has this mole here on the corner of her right eye. Inner canthus is flesh-colored, no redness. I don't see any open areas or drainage. Her bilateral sclera are both white in color. Both of her irises are light brown green. And her pupils are the same size, and they are black. I am going to take this and visualize both of her eyes. I'm just going to brush this over her left eye. Pupil did dilate, so it's reactive to light. Nope, still there. Left eye. Also reactive to light. When I do the left eye, I notice the right pupil also dilates. And if I do the right eye, I notice the left eye dilates. So it's positive for reactivity to light. I'm going to move down to Karen's ears and notice that the outside of her eye is in alignment with the top of her ear. I'm going to check this side as well. It's also even. Her ears are both intact, no open areas. When I tug on both of these, are any tenderness or pain?
No.
Okay. How about your traguses? Any pain?
No.
No. I'm going to switch over my tools and visualize the inner canal. So I'm going to pull down and back. Ear canal is pink, no wax buildup, no open areas. Tympanic membrane is a shiny silver. I'm going to move up to this side. Again, no wax buildup, no open areas. Tympanic membrane, shiny and intact. I'm going to move on to Karen's nose. Notice that it is midline to the face. No open areas. Bone structure is also midline, so I don't suspect any deviated septum. I'm going to have you close one nostril. Can you breathe through the other one?
Mm-hmm.
How's that?
Fine.
Good. Can you do the other one? Okay. Same way?
Yep.
Okay. So she can breathe through both if she blocks one, so that's good. And I'm going to have you tilt your head up. I'm going to take a peek inside both nasal cavities. No open areas on the left-hand side, no drainage. Looks pink but not irritated. And on the right side, no open areas, no drainage. Also looks good. I am going to palpate her sinuses up here as well. Do you have any tenderness?
No.
How about here?
Nope.
I'm going to put a light on her sinuses up here. Note the positive red reaction, which means her sinuses are air-filled and not fluid-filled. I'm going to move down here. Also a positive red reaction, which means they're air-filled and not fluid-filled. I'm going to move down to her mouth and note that her lips are midline body. They're pink, no open areas. I'm going to have you open your mouth for me. I'm going to inspect her mouth. Both bilateral buccal mucosa look pink and intact. Hard palate is intact, no open areas as well. I'm going to have you look down a little bit and just say, ah. Stick out your tongue. Uvula. Do it again for me. Uvula is pink and intact. Bilateral tonsils look good. No white spots, no open areas or lesions. I'm just going to look at her teeth. Can you smile for me? Teeth are an off-white color. Gums are pink. No bleeding, open areas or lesions present. She does have a top partial and a lower partial present. I'm actually going to move back up to the eyes because I did forget one thing. I'm going to have you push back a little bit. I'm going to have you cover your left eye. Leave your right eye open. And as soon as you start to see my hand, I want you to let me know. So peripheral vision is good in this eye. I'm going to have you close this one. Okay. Peripheral vision is intact. I think that concludes my assessment.